recovery doesn't define who I am. My name's Dible. I work as the Overdose Prevention Coordinator here at the Health Department. Well, I had really that picture perfect upbringing where my family was always involved in everything I did. My mom was a teacher, my dad was always coaching my sports, so I really excelled and I had a great childhood. I made a couple poor decisions along the way as I got older, and that kind of took me down a path where I didn't really ever see myself. I have a genetic predisposition for sure with substance use. I've lost some family members in my extended family to overdose. Thankfully, I have such a supportive family, and I know a lot of people don't have those supports. So for me, especially in the position I'm in now with my family, I want to be able to really utilize this work to help other people find supports, whatever that may be for them. Recovery to me is really just living your healthiest, best life. I think that looks different for everyone. I've found things that work for me, whether it's just even setting goals or having things to look forward to, things that seem small but that are really big when you really look at the grand scheme of things. It's definitely a lifelong journey. I mean, it's always something that you have to contend with. So even years later, it's important to make sure you don't deprioritize what you've done to make you healthy again and what you've done to really replace those things in your life. It being a lifelong journey, and it's just being able to live with the ups and downs of life, but being able to cope with it with healthy tools is what's been the biggest thing for me. Something that's been really unique for this job in my recovery has been being with law enforcement and first responders, being able to help expand leave behind and trying to reframe the way people may view those that are struggling has been really fulfilling, but also engaging with young people has been one of the biggest ways I can make an impact, because when I look back and trace back how I got into the situation I did in my life, it was all about really just a few poor choices, not grasping what that could mean for your future. So I try to just educate kids on making better choices, but also being equipped to know that you don't have to do something because of peer pressure. Understanding your risks is big, and that's been a focus of mine. Recovery Month is often thought of as a substance use issue, but I feel everyone struggles with something, and we're all kind of in recovery from something, and sometimes it feels like recovery from addiction is so on its own island that people can't relate, but it's all about kind of brain health and mental wellness. If your brain, which is the guiding organ that determines everything you do, is not well, of course people are going to struggle and make bad choices, and I think sometimes we forget that as a society. So Recovery Month to me kind of is that too.